know the why human trafficking work is needed, to fight for the freedom of modern-day slaves. But love, passion, commitment isn't all you need to be an effective and successful anti-trafficking advocate. Learn the how. I'm Dr. Celia Williamson, Director of the Human Trafficking and Social Justice Institute at the University of Toledo. Welcome to the Emancipation Nation podcast, where I'll provide you with the latest and best methods, policy, and practice discussed by experienced experts in the field so that you can cut through the noise, save time, and be about the work of saving lives. Okay, welcome back to the Emancipation Nation podcast. And today we're talking to Dr. Stacey Litam. And Stacey is a licensed professional clinical counselor in the state of Ohio and a nationally certified clinical counselor. She's an assistant professor also at Cleveland State University in the counseling education program. She's also a part-time instructor at Northeast Ohio Medical University, where she teaches the foundations of clinical medicine courses. She has over 5 years' experience within agency, college, and community mental health settings. She currently works as an LPCC at a Northeast Ohio agency, where she serves survivors of trafficking and persons with substance abuse disorders, and LGBTQ clients. She's a researcher, educator, and social justice advocate on topics related to human trafficking, human sexuality, and phenomenological experiences of individuals with intersecting marginalized identities. She's a little tiny woman with a lot of things that she's doing. So I love that because I'm a little short, tiny woman too. And we do powerful things. So she's facilitated over 50 state, national, and international presentations on topics of sex trafficking, human sexuality, decolonizing the minority myth stereotype, and the influence of internalized racism and intra-ethnic othering on Asian American identity development. Today, I'm going to be asking her about her work in the anti-trafficking field. So welcome, Dr. Litam. I'm happy you're able to join us today.
Hi, thank you for having me. That was a very comprehensive explanation of who I am and what I do. So thank you for that.
Yeah, I think my description of you is probably bigger than both of us if we stood on top of each other. But that's what good advocates do.
I think
they are busy. So I wanted to ask you, because there is a lot of confusion, and that's one of the reasons I wanted you to be on today, is a lot of confusion between what people call trauma-informed care and what people call trauma-informed therapy or trauma treatments. And people use those like interchangeably, but they actually mean different things. So tell us what the differences are.
Absolutely. And that is such an important question too, Dr. Williamson. So trauma-informed care really refers to the importance for helping professionals like social workers, like counselors, to be mindful of the influences of trauma on individuals' lives. So understanding how trauma histories might influence someone's neurological, biological, psychological, or social effects. So taking those effects into account into treatment is what trauma-informed care looks like. So again, recognizing the influence and the presence of trauma symptoms. And trauma-informed therapy refers to the actual evidence-based treatment modalities that individuals use to facilitate trauma recovery. So these are research-supported, evidence-based treatments. Often there are manualized treatments to facilitate the actual recovery of the trauma symptoms.
Okay, so all of us with, our master's degrees and our PhDs, we got that. But now tell us in English. So let's say trauma-informed care. Let's say I work in a probation department.
Mm-hmm.
And I'm a professional, but I want to make sure that my agency and myself is practicing good trauma informed care. So what does that look like for me as the worker in an agency like that?
Very good. So when I conceptualize trauma-informed care, what I'm really describing is the worldview or the lens that someone in an agency or a probation setting is using to conceptualize the ways in which people with trauma histories live their lives. So if I'm in an agency setting or a community mental health setting or a probation setting, for instance, individuals who may respond in specific ways. So they may be hypervigilant, they might be looking over their shoulder or uncomfortable with individuals who remind them of their oppressors or who have victimized them. That might be a way to understand them as trauma survivors. So trauma-informed care is the worldview or the lens which we are conceptualizing individuals who've experienced trauma histories.
So if I see someone that is, for example, a runaway, and they keep running away like 4 or 5 times a year, they run away. And you know, they keep coming before me as a probation officer, and I don't know what to do. Like, my first thought is that they're running away because they really don't want to listen to people,
Mm,
and they really don't want to follow the rules. And that's why they run away. If I'm trauma informed, I might have a different perspective on why they're running away or how I should treat them.
exactly. You're exactly right. So it's a much more affirming way to be mindful about whether there are other reasons that may better explain those unhelpful behaviors. There may be violence in the home or substances in the home or other experiences of trauma that are influencing those behaviors. So again, being more kind and curious about what might be going on.
Exactly. Like, perhaps that person is running from something. Perhaps running away is the best response given what's happening in their home, or somebody who might be um, going off at you. Maybe that's the way that they've learned to cope because of previous trauma.
Absolutely. Individuals who are trauma survivors, or I would even say just people in general, I believe we're all doing the best we can with what we have. And for individuals who haven't yet processed their trauma experiences, those unhelpful behaviors that we see as just behaviors like running away or substance use or returning to unhelpful or violent partners, people are doing the best they can with what they have, and perhaps they haven't just found other ways of behaving or new resources to adapt to those really challenging experiences.
Yeah, so people are doing the best. I like that. People are doing the best with what they have. What can you even break it down further? What is trauma?
Trauma is subjective, right? So what is traumatic for one person might be very different than what another person experiences as trauma. But generally speaking, trauma is an event that alters the way that someone conceptualizes their worldview or their ability to experience safety. So it might be anything from experiencing trafficking or being in a home where there's violence, experiencing substances in an unhelpful way. There are a lot of different things that can be traumatic, but generally an event that really shakes up someone's ability to make logical, linear decisions um, or obtain safety.
Yeah, and it kind of overwhelms your ability to cope. So it could be as tragic as a car accident. It could be a divorce, something that happens long term. Is that correct?
Yes, and I think about too, the underlying experience of trauma has some type of component where someone believes their safety has been compromised. So in all of everyone's brain is different, but all of us generally have this neat little almond shaped part of our brain called the amygdala. And what's interesting about the amygdala is it stores deep emotion but has no sense of time. And so when someone survives a trauma experience, what often happens is when a similar experience reminds them of that previous trauma, that amygdala lights up like a Christmas tree. And so it immediately compromises their ability, as you said, to maybe ask for help or resort to resources. And it really inhibits their abilities to think clearly in that moment because they're overwhelmed with that experience of fear and just they can feel quite compromised.
And so it could be a smell
Mm-hmm.
that sort of reminds them, even subconsciously. It could be a color, a scene, a sound that
Yes.
sort of triggers and overwhelms them, and their response may seem inappropriate. And so you respond to that in a way that you respond to inappropriateness. But when you're trauma trained, when you're trauma informed, then you look for other explanations for why this person may be acting hypervigilant or acting, out of the ordinary or going off, not just they don't want to follow the rules or whatever. There could be deeper reasons, deeper explanations for that, right? And so great people like yourself that are trauma informed therapists. Now, what do you do if we're smart enough to understand that, you know, our environments need to be trauma informed,
Mm-hmm.
our language needs to be trauma informed, our policies need to be trauma informed, and we need to be smart enough to identify somebody has trauma and get them to people like you. And then what kinds of things do you do?
So I know you had mentioned working with adolescents and how frustrating it can be to work with clients who either terminate early or who are runaways. I always tell my students and my colleagues when it comes to being trauma informed and working with clients who have these really challenging behaviors, don't get furious, get curious. So explore, as you mentioned, other alternative explanations to the behaviors. I, as a counselor, I'm always mindful of not using, for instance, trafficking language when working with trafficked survivors, because as you know, a lot of trafficked survivors don't use that language themselves and often don't even identify themselves as trafficking survivors. So they may say, I'm living the life, I'm working the streets, I'm helping my partner, helping my boyfriend. So using the language that our clients are coming with, I find is another trauma-informed way to make those really important therapeutic connections that builds trust, builds rapport, and hopefully keeps them from terminating early so they continue to come back to get that really important treatment.
I think that's awesome. I love that. Don't get furious, get curious. And I love the idea of being mindful of your language. I think most of us, some of us have learned, maybe not to call people prostitutes because that could be really traumatizing and stigmatizing. But sometimes we go around calling them trafficking victims, and some people don't appreciate being called a victim if that's not the language that they use and that's not the perspective that they have, correct?
Absolutely.
It seems like, some of the things that we could do is educate ourselves, I guess, on the best language to use, and even in our agencies, the setting that we have. I mean, are you cognizant of that? Do you tell people about the setting along with the language?
Yes. So one of the other areas that I specialize in is working with the LGBTQ plus population, and so I always encourage individuals to have pamphlets or information available for people with non-dominant sexual orientations. And I prefer to use the term non-dominant sexual orientation and not sexual minorities because there's nothing minor about us. And so using again that affirming language. So when I'm screening for um, intimate relationships, I ask about partners and not boyfriends or girlfriends, because that might keep people from disclosing with whom they are attracted or with whom they're working with or seeing. And so within agency settings, just those little bits of affirming language, like using the word partner, can be helpful. Having different things in place for a variety of individuals with different identities can be helpful too. So not everyone has a two-parent household. Not everyone has mom and dad. It could be dad and dad or mom and mom. And I just think it's important to have a lot of different opportunities to serve all of our clients, not just specific groups of clients.
Yeah, I like that as well because it is very affirming. I mean, even down to your application, are you married, single, or divorced?
Mm-hmm.
It's like, what? I'm neither of those. Or are you black, white, Asian, Native American, or other? Something
Exactly.
other that we don't have time to figure it out. You're something other than with us.
Right. Yeah, exactly. So we like to use the blank. So especially for things like gender, not doing the forced choice for gender or for race or ethnicity, just having that blank so people can write in how they identify. I think that can be a really great step in creating not just an affirming, but also a trauma-informed environment in whichever setting you're working.
Yeah, absolutely. I think that's awesome. And I think it kind of opens people's eyes to think about the privilege that they have. And for instance, I have the privilege of being able bodied. So I never have to consider when I leave how I'm going to walk down the stairs or how I'm going to step off of a curb. I'm privileged in that sense that I don't have to think about that. So I have to make myself think about those things so that as I'm creating, I need to be talking to those folks, those populations, and I need to be cognizant of what their barriers and oppressions are so that I can be trauma informed so that I don't commit these microaggressions against groups of people that I'm not intentionally trying to do that, but it's just I'm not cognizant of it because I'm not really trauma informed in that way. Being mindful of language and those types of things are wonderful. For instance, I really don't like when I go to a business and I get on the elevator and there's music playing in the background that doesn't affirm in any way, shape, or form any music I have ever listened to or will ever listen to.
Tell me more. Tell me more about that.
Or you go in a place and you pick up the magazine or the brochure and it there's people on there that don't look like you and
Yeah.
don't look like any of the clients that the agency actually serves. So that's interesting. So let's say we do get them to we know enough to get them to a trauma trained therapist, because one of the things that people don't understand, which is what I didn't understand, was that a counselor is a counselor is a counselor. No?
Mm. Yeah, so you raise a very good point. Counselors in general are trained to be generalists, and so even though that's fantastic, a generalist is not going to be able to provide the trauma-informed therapy that a trauma survivor will most benefit from. So yeah, a counselor is great, but certainly more helpful to find a trauma-informed therapist or someone who specializes in trauma, and even specifically working with sex trafficking survivors to better help that specific population.
Yeah, see, I want to underscore that because that's so critical. Someone trained and someone perhaps that has worked with survivors in the past.
Mm.
And I never thought about, I always thought like when I went to an attorney, for example, I just go to an attorney. No, there's intellectual property rights attorneys, there's, civil attorneys, criminal attorneys. And the same thing is true with therapy. I mean, I'm a university professor. You can come to me and talk all day long if you want, but I'm trained in social work. So if you come to me and talk about pharmacy or criminal justice, I can talk to you, but it's probably not going to be really good. So it's important to get clients to people who can actually be incredible with the work that they do with them. And so what type of trauma therapies or treatments do you prefer and why?
Yeah. So there are two trauma-informed therapies that I really gravitate to, and in fact, my agency uses them for their group therapies with our trauma survivors. The first of which is called Seeking Safety, and that is a manualized, evidence-based, trauma-informed treatment that addresses the impact of trauma on individuals who have post-traumatic stress, also with substance use disorders. And what's really nice about the Seeking Safety Manual is that it has 25 topics that can be conducted in any order, and you can use them out of one at a time, same day, different days. But they include things like asking for help, setting boundaries in relationships, compassion, creating meaning, taking care of yourself. And so these really important topics that individuals sometimes overlook when they have experienced trauma. And each module, again, can be used standalone or in combination with other topics in the manual. So it's just a really good one for helping professionals who want to work in trauma but don't have that specific training. And so, again, that Seeking Safety Manual by Lisa Najavis is a really good one. When I'm doing individual therapy, I myself gravitate to narrative exposure therapy. This is another standardized evidence-based treatment manual developed by Schauer, Neuner, and Elbert. You can buy both of these books on Amazon for a pretty affordable price, so I do recommend that. But what I love about the narrative exposure therapy is it really teaches trauma survivors that your life is not about that trauma story. In fact, that trauma story is embedded in the larger narrative of your life. And so within that life narrative, you have helpful memories, unhelpful memories, good memories, bad memories, and that one sole trauma memory does not define you and does not define your future. And so it teaches individuals to tell their trauma stories in ways that are more affirming, and it combines other evidence-based treatments like relaxation techniques, like mindfulness, like things including perhaps guided breathing, diaphragmatic breathing, and progressive muscle relaxation to empower individuals to tell their trauma stories in ways that no longer trigger those physiological effects of trauma.
I'm in love with the words evidence-based. I love evidence-based because the alternative is we're just doing something we think is a good idea. Evidence-based is something that's been studied. So have these Seeking Safety and narrative exposure therapy has been studied by researchers?
Absolutely. And both are found to be efficacious with adults, with adolescents, across individuals with different ethnic and racial backgrounds. They found to be efficacious with individuals with multiple traumas, with substance use disorders, even with individuals with trauma symptoms, but who have not been diagnosed with post-traumatic stress disorder. So really just incredible treatment modalities for a variety of diverse clients.
And would you say that most trafficking victims have some sort of trauma?
Absolutely, yes.
And I think people have this vision that somebody walks out of their house and they're snatched into a car and trafficked, and they had never had any trauma before. But it seems like what we're seeing is that it's more likely vulnerable people that may be trafficked, and they're vulnerable because they may have had earlier traumas across a variety of different, maybe abuses, poverty, those types of things. So it seems to be trauma seems to be the thing that's creating this vulnerability, that's creating making young people or adults vulnerable to be manipulated or forced or coerced into trafficking. Do you think that's accurate, or would you add anything to that?
I think that's accurate. And I would add that, I have had cases where traffic survivors say, no, I choose to do this. I choose to sell my body to help my boyfriend. I choose to sell my body for sex, to help this third person party for whatever reason. And both my own anecdotal clinical experience combined with what I see in the research is that every individual who does report to choose sex work has had, as you've said, an intense, ongoing, complex history of trauma from childhood, whether that was an unstable household, whether that was history of substance use or domestic violence, rape, incest, sexual abuse, domestic violence. And what we know about the influence of trauma in development, especially in adolescence, is when we experience trauma from an early age, it really does inhibit our brain's ability to develop normally. And so with this lack of neurotypical development, individuals who are trauma survivors are less able to make pragmatic choices, are less able to engage in logical linear decision making in times of crisis. And so individuals who do choose, and I'm using the little bunny air quotes, you can't see, individuals who do report to choose to engage in sex work do so against a severe backdrop of inequality. So the question of choice and agency, in my opinion, is quite compromised because those individuals have had such trauma experiences, such complex trauma experiences from childhood.
Yes, yes. And so a part of there is a strong uh, sex worker advocacy group or several groups that um, talk about their oppression is from the fine social workers who keep trying to rescue them from something they don't want to be rescued from.
Mm-hmm.
So it becomes a very complex issue. What do you do when somebody is not ready? You know, they've had a lot of trauma, but um, they're just not ready to work on it or face it or, process through it.
Oh gosh, I see that so often. And it's heartbreaking, as I'm sure you can imagine, or I'm sure you might have experienced in your own work, when you see or you know that your person sitting across from you is a trauma survivor, but they don't want to talk about it or they're not ready. And the hardest part, I think, about being in this field is sometimes your work with clients who aren't ready is just sitting with them until they are ready and being mindful and being kind to yourself as a helping professional, knowing that sometimes the best you can do in that moment is sitting with the client in that darkness. And what I like to try and do with clients who aren't quite ready to process is to just offer opportunities or invitations for them to process, and to give a name to their experience. So one unique thing about experiences is until there's a name to label that experience, we often don't acknowledge it. And so sometimes people don't even know that what they're carrying, what they are experiencing is a trauma experience. So I like to use a technique that I call general to specific. So I might say something like, so and so, many individuals who've experienced trauma have a difficult time falling and staying asleep at night. They may have a hard time trusting others. They may struggle to ask for help in times of stress. They may feel sad for no reason. I'm wondering if that's true for you. So now here I am listing symptoms that I know to be true of a trauma experience, and then inviting the client to say, is this your experience?
Yeah, that's excellent because trauma really affects your ability to have a healthy relationship, to work a job, to process through daily hassles and daily problems. It really affects every aspect of your life, whether you're a trafficking victim or not. Anybody that has experienced trauma. And so what's the difference between like someone who experiences a traumatic experience, a car accident, domestic violence, um, once or something, and somebody that experiences domestic violence or sexual assault or trafficking over and over and over? Do those folks need different therapies, or what's the difference there?
So it depends. And I know I hate giving that answer, but it depends on the person. It depends on a couple different things, including their own resilience, including their own worldview. So some individuals can have a really great prognosis, even though they've experienced multiple traumas, ongoing traumatic experiences. And some other individuals who don't have those social supports in place, abilities to set that event as apart from who they are as a person, and have that one event become so overwhelming. But generally speaking, individuals with ongoing trauma, more chronic trauma, will need much more intense trauma-informed therapy compared to someone who might have experienced just one singular car accident, for instance. What are your thoughts on that?
Yeah, I mean, I agree. I think it's, in the eye of the beholder, and um, we can't really say, well, this experience wasn't as traumatic as, those experiences. So I agree.
Mm-hmm.
Um, and so I'm sure you've seen clients, like many counselors do, who just recount what happened to them. They give you a list of, oh yeah, this happened, this happened, this happened, this happened, as if they're reading the phone book. So
Mm-hmm.
what's going on there?
Well, it depends. So in some cases, clients have dissociated from the event and are able to retell it, but without that physiological response, which depending on the client can be helpful. So as a trauma therapist or a trauma counselor, it is important to note that there are two schools of thought when it comes to trauma counseling. So the first of which is, some people believe that it is absolutely essential to have clients go back and retell their trauma stories. And the other group of thought is that you don't always need to. So it depends on, number one, how the client responded in the time of trauma. So clients who dissociated in the traumatic event are more likely to dissociate when recalling the trauma, which means when you're in a therapeutic relationship with a client, if they have dissociated in the trauma, they are likely to dissociate in the retelling of the trauma, which means retelling the trauma is likely going to be unhelpful in your work as a counselor. In which case, you're going to want to focus on the recurring symptoms that have developed because of the trauma. So if that means the client has a hard time setting boundaries, you work on that. If that means the client has a hard time falling and staying asleep at night, you work on sleep hygiene. If that means the client has a hard time um, engaging in communication abilities, perhaps you focus on assertive communication skills. So you work on the effects of the trauma as it affects them on a daily basis, and not the retelling of the trauma. So it really depends on what that client is bringing to you in the therapy.
That's great advice. And so, is there any other advice that you would give the counselors? You talked once about being kind to yourself as a counselor. Um, any other advice?
I think being kind to yourself as a counselor is important. I think we all, whether you're a social worker or a counselor or a psychologist or any helping professional working with people, we come into this field because we have these big hearts. We come in this field because we want to leave this world better than how we found it. And often what happens is we're giving so much of ourselves, and we give so much of ourselves to our clients, that we forget to take care of and invest in ourselves. And so we see early burnout, we see secondary traumatization in our profession with people who work with these really complicated sexual trauma clients. And so making sure we're not working harder than our clients can be really important. Understanding that sometimes clients just aren't ready to work on their trauma, and that's not a reflection of us as counselors or social workers or helpers. Um, I think getting supervision is essential in this work. We're never operating in silos. It's always possible to connect with other people, to share your story, to unload a little bit so that we're not carrying home that energy from our sessions. I think that's really important.
That's so important. And so for someone that's listening that wants to be a professional, they're not a professional clinical counselor yet, or they're not a clinical social worker yet, is there any advice? What would you advise them to do if they get on this path? And that's their dream, to become a trauma trained therapist to help survivors. What would you advise them?
I would say look into programs nearby. Perhaps that might be a master's in clinical mental health counseling. That might be a master's in social work. There are a lot of ways to get involved, but if you want to work with clients individually, therapeutically, one-on-one, using trauma-informed therapy, you've got to get the education and the clinical experience. And then once you get that, you get the additional training, the trauma-informed training.
Yes. And do you ever take interns, or do you do a thesis with students? Do you involve your students in any of the work that you do?
I do sometimes have students that I'll do research with, or write articles or practice briefs with. But I do a lot of workshops, a lot of educational workshops on understanding sex trafficking, or what counselors should know about working with sex trafficking survivors. So, yeah, I think that there are a lot of ways for students to get involved.
And do you have do you periodically do workshops, or where would people, if they wanted more information, how could they get in touch with you?
So my email is s.litam at csuohio.edu. So s.litam at csuohio.edu. And then I just kind of do the counseling conference circuit. So I'll be at the American Counseling Association conference in San Diego in April, and I'll be at the Ohio Association for Counselors conference in November in Columbus.
See, I knew you were a busy woman, just very busy about your business. I like it. This is amazing. And so, and if people want to have you come into their community and do a workshop, I suppose they can email you about that and give you information.
Yes, please. I would love to.
Absolutely wonderful. So, any parting words, Stacey, about your work, or any advice?
Just that I think it's important to remember that you are powerful, you are worthy of love, and what you are doing as a helping professional is so important. And so, um, just to be kind to yourself and remember that people, including our clients, are all doing the best they can with what they have.
I think that's a wonderful ending. Thank you so much, Dr. Litam. I appreciate your time. I know you're super busy, but thank you for sharing those nuggets, those jewels that counselors and people who want to be counselors and advocates who are trying to find good counselors um, learned about today, because we really need to get people to really good trauma treatment counselors. So thank you again. I appreciate your time.
Of course, thank you for having me. This was fun.
Dr. Stacey Litam talks about the differences between trauma informed care and trauma treatment. Trauma informed care is a perspective. It's a way you carry out your business, in your policies, in your practices, in your behavior. Trauma treatment is a modality, an evidence-based modality that a therapist is trained to implement with people that experience trauma. Now, your traumatic experiences do not make up your whole being. You are much more than your trauma. However, if you don't take care of your trauma, if you don't handle your trauma, if you don't work through your trauma, it can overtake your whole being and who you aspire to be now and in the future. People can only meet you as deeply as they have met themselves. So if we've experienced trauma, we need to handle it. We need to see a therapist. We need to work through it. We cannot squash it down. We cannot dismiss it. We can't deny it. We have to work through it. You ever see people that you just look at them and they're wise? You know, they're very wise. And it comes from working through your problems. Wisdom doesn't necessarily come with age. It doesn't, because you see very wise young people, and the evidence is that you see some not so smart or wise older people. So it's not really connected to age. It's connected to going through your problems and coming out the other side victorious. Some people go under it, around it, avoid it, squash it down, deny it. But it's the people that confront it, work through it on a daily basis, that gain wisdom from that. And you can feel it, you can see it, you can hear it, and in the way that they talk and the way they conduct themselves. So handling your trauma is something that some people experience, and when they do it successfully, you see it in their daily work, and they come out the other side wiser, stronger, and they start to experience post-traumatic growth, where they start to know deeply who they are, what their triggers are, and what they need to do to work through it to become even more successful every single day. If you like this episode of Emancipation Nation, please subscribe, and I'll send you the weekly podcast. Until then, the fight continues.